Good afternoon. We continue our learning today on the VTE awareness by looking at the risk factors for clot formation. You may be young, physically fit, and even healthy and still get a clot. You do not have to be sick, elderly, or admitted for you to get a clot. Clots do not occur randomly, and the clots are triggered by three key risk factors, which is what we call the Virchow's triad. One is stasis. Anything that slows down or decreases blood flow triggers clot formation. Risk number two is endothelial injury. Anything that causes damage to the blood vessel can also trigger clot formation. And finally, hypercoagulable state. Anything that increases the tendency of the blood to clot can lead to clot formation. So those three major factors are what predispose one to clot formation. And we are going to learn the 10 main risk factors for VTE. We need to be aware of those risks so that we can protect ourselves from clot formation. And number one is pregnancy and the postpartum period. When you are pregnant, this increases the clot formation. There is slowing of the blood vessel. There is also increased inflammation in pregnancy and also compression of the veins. And this continues up to 6 weeks post-delivery. So if you are pregnant or in the postpartum period, you are at high risk of clot formation and you need to take measures to prevent yourself from getting a clot. Number two is surgery or recent hospitalization. Many surgeries which last more than 30 minutes, especially orthopedic surgeries, hip surgeries, knee surgeries, increase someone at risk of clot formation due to many factors. One, you are immobile. There is also injury to the blood vessels. And it is important to have a discussion with your surgeon if you need preventive measures for DVT. Number three is cancer and cancer treatment. Anyone who has a cancer, ongoing cancer, or is on treatment is at high risk of clot formation. And if you identify any of the symptoms we talked about yesterday, you need to rush to hospital. Birth control pills or hormonotherapy is the other major risk factor for clot formation. For the ladies who are on the combined oral pills, the COCs, those increase your risk of clot formation. And it is not just the combined pills, these emergency pills, the herbal pills ladies are taking monthly, they increase your risk of clot formation. So if you have to be on contraceptives, please use the non-estrogen containing pills. Number five is sitting for too long. I'll be having a session where I'll talk of economy class syndrome. Sitting for too long, long flights, any travel more than 4 hours increases your risk of clot formation. And when we look of prevention, we'll be talking on how to prevent yourself from getting a clot. Number six is dehydration. Once you sweat a lot, you are not hydrating well. This slows down the blood flow and can predispose to clot formation. Number seven is obesity. Excess weight increases the inflammation, also puts pressure on the veins, which can increase the risk for clot formation. Family history is another major risk factor. There are people with genetic disorders with predisposition to clot formation. This leads to clots being formed in abnormal sites or clots with no underlying risk factors. Number nine is smoking. Smoking is also another major risk factor to clot formation. It increases inflammation and also the hypercoagulable state. And finally is infection. Many infections increase the risk to clot formation. Infections, chronic conditions like heart failure, infections like COVID, all these increase your risk for clot formation. Please note, most of these risk factors are preventable. That is why it's important to know the risk factors for clot formation so that you can act to prevent yourself from getting a clot. Remember, we said clots are deadly and sometimes they have no risk factors. And sometimes they have no warning signs. So if you know you are at risk, you know you are pregnant, you have a risk of clot formation. You have had a recent surgery, discuss with your doctor if you need DVT prophylaxis. If you are using the combined pills, use alternative contraceptives. If you sit in an office for many hours, you are traveling for a long journey, you need to take measures to prevent yourself from clot formation. Dr. Beatrice Muthui-Mutua, saving lives one heart at a time.